Anybody's at risk. I've been giving HIV positive results to the most unlikely person that they had no clue. We had no symptoms. You know, HIV is a very tricky virus. It has evolved, it has adapted, it has changed, and it has mutated. It has learned how to, hide in individuals and communities. Every year we get thousands of new infections. Every day, every week at the clinic where I test, I give an HIV positive result. And I can see it in their eyes, I can see it in their face, how they view what is happening to them. And that could have been avoided by having an HIV vaccine. Just last week, I told an immigrant from a South American country that they had HIV, he didn't have a clue, married, 2 kids, undocumented. And I was thinking, God, how more difficult can that be? How do you break that news to your wife? How do you tell her? How do you tell your kids? How are you going to access HIV care? How do I ease up his fears and his tears? How do I do that? You have to take a moment and actually put everything aside. Put all your clinical skills, put everything else aside, and just embrace that person, that let them know that it's going to be fine, that it's going to be okay, that there's light at the end of the tunnel. Involvement in various communities, including the gay community, the Latino community, the immigrant community, the African American community, not one particular community, but all communities, is very essential. Community, individuals, and scientists need to work together to diversify the folks that they get involved. It sounds easier to say than to do. Why is that? We're fighting against discrimination, we're fighting against oppression, we're fighting against all these fears and obstacles and taboos. Just because an immigrant from Oaxaca, Mexico crossed the border, it doesn't mean that they left those taboos, those gaps, those misunderstandings that they grew up with. So being able to break down those barriers and those taboos and those obstacles, whether it's fear of testing, whether it's distrust, whether it's lack of access, whether it's lack of professionals that understand their culture or understand their language, those are really key things to address before somebody wants to do a test. So once we have planted the seed about why is it important for you to participate, and we build a consciousness in a individual and a community, that's when we can begin to see fruitful outcomes.